Correctional Service Canada's Prairie Region has recently introduced the Traditional Healer in Medicine program at Okama-Ochi Healing Lodge, otherwise known as OHL. This culturally based health program was integrated into the health service delivery model at OHL and is intended to advance the healing of federally incarcerated Indigenous women by promoting physical, mental, and spiritual wellness and enhancing connection to culture. The program includes traditional medicine, ceremonies, and cultural teachings, mental and spiritual guidance, and tools that help improve residents' overall well-being. The Center for Forensic Behavioral Science and Justice Studies conducted an evaluation of the pilot phase of the Traditional Healer in Medicine program over a 12-month period to provide an in-depth understanding of the program and how it operates, highlight the successes and challenges encountered during the initial implementation of the program and throughout program delivery, and evaluate changes, if any, in residents' wellness and cultural connectedness as a result of participating in the program. 2 data collection phases were employed to gather quantitative and qualitative information from 21 program participants and 17 program collaborators with respect to their perceptions surrounding the implementation, delivery, and outcomes of the program. In the first phase of the evaluation, semi-structured one-on-one interviews were conducted with 7 key program collaborators working in the fields of CSC Health Services personnel, OHL personnel, and traditional healing team members. 4 themes were identified from program collaborators regarding the perceived purposes, goals, and objectives of the program, including access to culture and traditional healing, integration of traditional and Western medical practices, complementary alternative to Western medicine, and an increase in overall wellness. A key strength mentioned was that the Traditional Healer in Medicine program serves as a unique resource, bridging the gap between Western and traditional medicine, that provides residents with opportunities for healing as well as cultural and social supports. One specific challenge brought up included that a smaller than expected traditional healing team led to increased tasks for each member that distracted them from their primary responsibilities as healers. In the second phase of the evaluation, a self-report questionnaire was employed to OHL residents and program collaborators. However, not everyone who was invited to participate ultimately agreed to complete the study. Based on the information gathered, the sample did include many of those with direct experience with the program, ultimately 21 OHL residents and 17 program collaborators in person, in addition to semi-structured interviews. Overall, the perceived purpose of the program was consistent across respondents in that it provides access to culture and traditional healing and medicine, serves as an additional healthcare option that addresses cultural needs, focuses on improving residents' well-being, and intends to have an impact on community reintegration and living. Participants agreed that the Traditional Healer in Medicine program has filled a significant gap in the provision of healthcare services at OHL, providing a supplementary option to Western medicine that allows residents to choose their healthcare plan and benefit from accessing culture, traditional healing, and traditional medicines to address their health-related needs. Residents highlighted a few strengths and challenges. Specific strengths of the program included having access to traditional medicine, ceremonies and cultural teachings, mental and spiritual guidance that ultimately improved residents' overall well-being. Residents also enjoyed learning about traditional medicine, and the integration of both Western and traditional medicine led to openness of seeking both types of support. One specific challenge noted was that the traditional healing team was not on site as much as needed for the residents. And with respect to health, residents rated their physical, mental, and spiritual health as slightly above average and important to the overall quality of life. Energy work, mental and spiritual support and guidance, traditional medicine, and cultural teachings made residents feel comfortable and supported while ultimately improving physical, mental, and spiritual health. When assessing wellness and correctional outcomes, results indicated that the healers provided support and guidance that led to a better outlook on life with healthier relationships with oneself and others. The program guided residents on a path toward better living in the community, reconnection with culture and family members, and encouragement to seek out traditional healing supports in the community. In conclusion, both residents and program collaborators highlighted the perceived positive impacts of the program, holding the perception that it has contributed to better overall mental, spiritual, social, and physical wellness, as well as a stronger connection to culture for those who regularly see the traditional healing team. Traditional medicine helped the residents manage physical illness and led to improved energy levels, healthier thoughts and peace, and better control of emotions and situation management. The traditional healer in medicine program helped residents reconnect to cultural traditions and spirituality and gain a stronger connection to oneself, culture, and the creator. Although these findings have been identified, it is important to note that the first phase of the evaluation was not done through proper Indigenous evaluation strategies, thus limiting cultural guidance and interpretation of the evaluation findings. Taken together, this report and its findings has provided valuable insight into the factors to consider for successfully expanding a traditional medicine program to other CSC-operated correctional facilities. In conclusion, both residents and program collaborators highlighted the perceived positive impacts of the program, holding the perception that it has contributed to better overall mental, spiritual, social, and physical wellness, as well as a stronger connection to culture for those who regularly see the traditional healing team. Traditional medicine helped the residents manage physical illness and led to improved energy levels, healthier thoughts and peace, and better control of emotions and situation management. The traditional healer in medicine program helped residents reconnect to cultural traditions and spirituality and gain a stronger connection to oneself, culture, and the creator.